Bunions, as we commonly call them, are prominent deformities of the big toe on the inside, and this is often combined with big toe turning out towards the smaller toes. It is relatively common. You could have this from a genetic influence or from inflammatory conditions such as rheumatoid arthritis, and sometimes there is no reason at all. Basically, you have a bone prominence on the inside of your big toe, which gradually gets bigger, and it can rub against your shoes and lead to swelling, pain, and difficulty with your activity level. Some patients can have minor wear and tear of the big toe joint, which mimics a bunion deformity, but an orthopedic foot and ankle specialist could differentiate these two easily. Bunions can be treated simply by modifying your shoes to fit the foot better. In these days, you have wider forefoot shoes available, and these can be a simple and effective solution. Sometimes toe separators can be used to keep the big toe straighter, and this prevents or reduces inflammation on the inside of your shoe. Simple painkillers can be beneficial. You can finally consider surgical options. Surgery is not always needed for everyone, but sometimes it is the only option left out, having tried other measures we just discussed. I'd like to make it clear at the outset that bunion surgery is not painful anymore, thanks to the advanced techniques we use in correcting and fixing them with screws often, and also the anesthetic techniques, which is often a full general anesthetic combined with local blocks to make your foot numb, works really well. And many patients have painkillers for about 3 days, and it's not used to be painful as in the old days. This is an important aspect. The surgery is often straightforward, takes about an hour, and it's often day case surgery, and you go home same day with sandals and maybe crutches for balance. But the recovery time is about 4 to 6 weeks. Patients recover differently based on their general health and other medical conditions they may have, but often it's approximately 4 to 6 weeks. You need to be using a rigid sandal during this time, and the first 2 weeks are really important. I would recommend you keeping your foot up as much as possible and do as little you have to for the first 2 weeks. Once the wound healing is complete around 2 weeks, we will reduce the dressings or take it off completely. We'll advise you when you can change from sandals to supported trainers, which varies from 4 or 6 weeks. Around 6 to 8 weeks, you can use your normal shoes and trainers, whatever you prefer, as swelling permits. This is an important point. The swelling may take quite a few months, although it is small amount, but it may take longer than you think. Following the operation for bunions, you take care of your weight bearing in the initial few weeks. We will allow you to walk out of the hospital, but we advise not to take full weight on the foot for a few weeks. You can walk on the heel, and every week it can be increased as directed. So around 4 weeks most people can take full weight on it, but suddenly 6 weeks time you'll be walking fully on that foot. And we should avoid going to gym or any impact activities on it for a few weeks. You can do some upper body exercises if you're really keen, but we recommend not to use impact activity on the foot first. But once you recovered from the surgery, which is 6 to 8 weeks, and around 3 months onwards, a lot of your regular activities can be started again. And there is no restriction at the end of the day. You can return to all your activities before surgery.